Regional health is shaping as a battleground at the next state election, with the Labor and Liberal parties exchanging blows over who would spend the most on regional health. Flow News 24 caught up with South Australian Health Minister Stephen Wade on the competing commitments on spending on country health, but I also spoke with him about the spending commitment on the Barossa Hospital and a new preventative health program including funding for exercise in the Elliston district. Minister, the Labor Party late last week put out a press release saying that they would redirect funding designed for what they call a basketball stadium for country health. You had some points to make about Labor's record on country health.
Yeah, Labor's regional health pledge is nothing but spin. You only have to look at what Labor did in office to realise which party delivers for the regions. In 2008, Labor tried to downgrade, even close dozens of hospitals in country South Australia. And during their last term of government, they spent a mere $14 million on regional health infrastructure. In contrast, in our first 3 years, the Marshall Liberal government has spent more than $70 million and committed much more. We're outspending Labor on regional health infrastructure by 5 to 1. We've already committed a significant amount of money going forward. In fact, in the first 4 years of government and hopefully in the next term of government, we'll be delivering more than $200 million in regional health infrastructure. We know how important it is for people in the regions to have infrastructure which is up to date, which is well supported by a regional health workforce. That's why we're spending another $20 million to make sure that we can recruit and retain quality regional health workforce. We're very determined to improve services in the country. By the end of this year, we would have doubled the cancer services provided in the country. We're putting another 24 more full-time ambulance officers in country South Australia, upgrading emergency departments right across the state. So the Marshall Liberal government has shown its commitment to the country and Labor's record condemns them.
When it comes to health spending, can you give us some more clarity around the commitment on the Barossa Hospital? It looks to us like there's a further business case and $5 million set aside for land in the out year of the budget. Where is the government progressing on actually constructing a hospital in the Barossa?
So there's $6 million in the forward estimates. As you say, part of that is to actually buy the land. Part of it is to plan, but it's not a business case in the sense of asking, are we going to build a hospital? We've done a lot of planning in the first term of government, which makes it clear that the Barossa community not only needs a hospital, but that it stacks up. So we're now into the planning phase. One of the key priorities is to identify the best site to plan how the services would fit together. This is fundamentally bringing together the Tanunda and Angaston hospital sites. Both of them are well past their use by date. The Barossa Hospital, in terms of this initial $6 million, is in the forward estimates. But again, that's a commitment that the Marshall Liberal government is making for the long term. That's another example of the Marshall government investing in country services.
And just before you go, if we can, I just picked up your media release sent out today regarding, I guess you could say, preventative health programs and grants and something for the people of Elliston, I think an exercise trail or something like that. Could you just give us a bit of comment about the intention when it comes to preventative health and those grants?
Yeah, we're very determined to support country South Australians to live healthy, happy lives in their communities. We know that rural and regional South Australians on the whole have lower health status than their metropolitan cousins. So one of our early commitments was for $1 million investment in preventive programs in country South Australia. So we're announcing the next wave today. So I'm actually in Whyalla, having visited an Aboriginal community-led bush foods garden. We've got an event at Tumby Bay in relation to resilience and connecting the community for young people to try and help them live healthy lives. There's a food bank, food hub at Sejuna. There's a pump track along the coastal trail at Elliston. So the government is working with the community to identify opportunities to support health and wellbeing right across country South Australia.
So it's good to see investment in preventative health, but you're saying statistically, compared to metropolitan people, country people's health outcomes are generally poorer when it comes to physical health. Is that what the stats are showing you?
Yes, indeed. And part of that is early intervention. Country people don't have such good access to screening services, and we know that screening is often key to identifying an issue early and getting treatment. But also, many of the treatment journeys themselves are challenging journeys, and so people might not be forward-leaning in dealing with their health issues. That's one of the issues, for example, in cancer services. We're doubling the level of cancer treatments that are being delivered in country South Australia, at a number of sites introducing medium-level complexity cancer treatments. And we believe that will see more country South Australians getting their care closer to home to continue right through the treatment regime and delivering better health outcomes. Certainly, no matter which part of South Australia you're in, the Marshall government is committed to supporting the health and wellbeing of all our citizens.
Yeah, I'm glad I got that clarification from you. It might seem to some people you're saying we're not as fit as city people, but there's a lot more to the health picture than just whether you can run around on a football field.
Indeed, and one of the key issues is making sure that we continue to build the health workforce, the health infrastructure, the health services, so that we can support people to get the help when they need it.
Well, Minister Wade, thank you for joining us today on Flow.
Great.